Hello, I'm Dr. Neil Schultz, and welcome to DermTV. Welcome back to Viewer Question Week, and today's questions come from DermTV.com viewers. But first, in last week's episode on whether your skin gets used to the effects of skincare products, I promised you that the first 3 viewers to answer my question correctly would receive a free BeautyRx skincare product. And the question was, which is the only skincare or skincare-related product whose beneficial effects can stop working because you get used to them? There were 3 winners who correctly responded that your shampoo can stop working if you use the same shampoo, and in order to avoid shampoo failure, occasionally you need to use a different shampoo approximately every week or every other week. So with that answered, let's move on to the questions from DermTV.com viewers. The first question's from Lisa. Hi, I've been breaking out since I was 14. I'm 27. Nothing has worked for me, and I've tried everything. I'm considering Accutane. Do you think it's a good choice? Does it really work for someone like me who's been prescribed everything else? Lisa, yes. The whole point of Accutane is that that's what we use when nothing has worked. And if you've had lots of antibiotics, you've tried birth control pills, and none of these things have been able to help your acne, it is time to move on to Accutane, which I believe is one of the 4 or 5 miracle drugs of the 20th century. Accutane, when used as directed, is safe and very effective. So good luck with your Accutane. The next question is from Malcolm. Can I use antioxidant vitamin C facial serum first and then apply a 10% glycolic acid serum? Malcolm, vitamin C and exfoliants are compatible, so there's no reason why you can't use those 2 products together. As to which you use first, it really depends on the relative weight of the 2 products. So you mentioned that you're using a vitamin C serum and a glycolic serum. Since they're both serums, what I would suggest is just try a little experiment. Put a little bit on the back of your hand and see which feels lighter. Whichever feels lighter is the one you should apply first, and then apply the other one on top. The next question is from Jay, and she asks, many over-the-counter lotions and creams contain retinols or vitamin A. Are they safe to use in pregnancy? And Jay, the answer is they're probably not safe to use in pregnancy. The problem is retinol becomes in the skin, retin A, and all of these retinoids in laboratory tests have been shown to cause birth defects in certain laboratory animals. Obviously, there's been no studies done to see whether they cause birth defects in humans. But our fear is that because we know that oral retinoids in humans can cause birth defects in the form of Accutane, we are concerned that we don't want to use any even topical retinoids during pregnancy. So please make sure, if you're trying to get pregnant or you are pregnant, that none of your skincare products contain any retinoid derivatives, retinol, differin, or any of the other topical retinoids that we use for acne or facial rejuvenation. Next question comes from Sarah. I'm 23 with blotchy skin. I need to wear foundation every day. I mostly have pigmentation from previous pimples and occasional breakouts. How often should I do a glycolic peel, and what concentration? Sarah, I really discourage people from doing glycolic peels at home, because today through the internet, all different sorts of very concentrated glycolic products are available, 40%, 50%. And the reality is these peeling solutions can do a lot of damage if you don't know how to use them and you don't use them properly. In terms of glycolic products that you can use safely at home, most of these products vary from 8 to 15%, and we don't really consider them to be peels. They're either in serums or lotions or creams, and they can be used every day or every other day, depending on where you're up to with your exfoliation and how sensitive your skin is. But my recommendations to both my patients and to all my DermTV viewers is that please use exfoliation, use it regularly. I love glycolic. I think it's the gold standard for chemical exfoliants. But just use safe concentrations. between 8% and 15% and use it according to the tolerance of your skin. But please don't purchase glycolic peeling solutions from the internet or anyplace else, because I'm afraid you're going to get into trouble with it. Laura asks, in what order do you apply exfoliating products? At night I use a cleanser, toner, eye cream, moisturizer. When should I use my glycolic acid? And by the way, I've been taking your advice to exfoliate more frequently. Do I use my glycolic before or after toner? And would toner affect the pH of the glycolic acid? Well, Laura, you really have 2 or 3 embedded questions here, and they're all very important, so I'm going to answer all of them. First of all, at night you would use your cleanser and toner first. And the whole point here is that cleanser and toner prepare your skin for all of the active ingredients you're going to use. So you certainly wouldn't use your toner after your glycolic product, because the toner would then remove it. Just the way your cleanser and toner are used to remove all of the dirt, debris, or oils on your skin and any other impediments that would prevent your glycolic and your other active ingredients from working. Second of all, would toner affect the pH of the glycolic? Really not, because after you've used your cleanser and you then use your toner to help remove any residual cleanser or debris left by your cleanser, that toner is going to evaporate. It's volatile. There won't be any toner left on your skin when it's time to put on your glycolic. So after your cleanser and toner, the first product that we usually recommend, but of course it depends on the relative weight of the product, the first product is usually your glycolic. Then after that you would put on your eye cream and then your moisturizer. So thanks for a great question. Next question comes from Jordan. And Jordan says, age spots, sunspots have started to show up on my face now that I'm 37. Is the best treatment for this A, IPL, B, peels, or C, patience plus a regimen of vitamin A and other exfoliants? Sort of expecting to see what other treatment is behind door 4. Jordan, and by the way, Jordan says, thanks to you, I exfoliate and wear sunscreen every day. Jordan, thanks. Well, the best treatment for age spots and sunspots depends on how many you have and what your tolerance is for a little bit of downtime from treatment. Because if you use the best treatment for sunspots actually is the YAG laser or Alexandrite laser, because these lasers will work the first time, every time, in destroying the age spots or brown spots. But when you use those treatments, they cause a little bit of black and blue or purple on your facial skin for anywhere from 5 to 7 days. The advantage of IPL treatments, which means intense pulse light, is that they usually don't cause the black and blue or the darkening. So there's usually very little visual downtime from that. But IPL you often have to do 2 or 3 times. So it's more visits and it's more expensive. Now, both of those are, whether it's the laser or the intense pulse light, they're both very effective and they both work either first time or first couple of times. If you're going to use peels to try to treat your age spots or sunspots, it's not as effective. You need lots and lots of treatments and it takes a longer time. But the peels that you should be using should be gentle chemical peels like glycolic peels, but you need them in conjunction with both a very effective sunscreen to make sure you're not causing any additional darkening from the sun or allowing additional darkening from the sun as you're going through the process. And you also need to use a bleach on a regular basis. The peels will help take off the dead cells that have too much pigment in them that are contributing to the brown spots, and the bleach will help prevent the new cells from making additional extra brown pigment. Your third choice was patience plus a regimen of Retin-A and other exfoliants. I find that just using exfoliants without actually doing chemical peels doesn't remove these brown spots completely. And if you want better results and faster results, don't want to go the laser or intense pulse light route, I would recommend the peels with the bleaches and the sunscreens. Our next question is submitted by an anonymous user. I always apply sunscreen underneath my makeup every morning, and it is almost impossible to reapply sunscreen on top of the makeup without messing it up. I'd like to ask Dr. Schultz what's the best way to reapply sunscreen while having makeup on. Well, this is a very important question and actually became the subject of a DermTV episode. And the answer here is very simple. If you apply your sunscreen first and then you apply your makeup, if your makeup is still there a few hours later, then undoubtedly the sunscreen is still there because it's underneath your makeup. The reason we need to reapply sunscreen every 2 or 3 hours is when you're very active and sweating or when you're swimming. But if you're going to work and you're putting on sunscreen and then you're putting on makeup and your activities aren't removing your makeup, then there's a very good chance that those activities aren't removing the sunscreen either. So there's no reason to reapply sunscreen and mess up your makeup. When it's time for a makeup change, when your makeup is wearing off, or you just want to change your makeup, that's the time to reapply your sunscreen, and obviously then it's not inconvenient to do. The last question for today is from Joanna, and she asks, I heard from your video that I should use sunscreen before my moisturizer, but the problem is when I do this, the moisturizer on top messed up all the sunscreen underneath. Some screen flaked off, and flakes off my face too. My face became a total mess. Please kindly advise me on the appropriate and feasible way of applying both on my face. Thank you. Joanna, it sounds like you may be putting too much sunscreen on, because when you apply your sunscreen in 20 or 30 seconds, it should set and it should be matte. It shouldn't still be liquid after you've applied it. So that when you're then applying your moisturizer, there shouldn't be any fluid sunscreen left for the moisturizer to affect. And if there is, perhaps you're just putting a little bit too much sunscreen on. So next time, try putting a little bit less sunscreen on, gently spreading it around, and if after 20 or 30 seconds it doesn't feel like the sunscreen has set, then just take a tissue and tissue off the extra sunscreen before you put your moisturizer on. Well, that's it for today's episode of answering questions from viewers. Don't forget, the subjects from so many DermTV episodes come from your questions, which are great. So please keep sending them in, and I'll keep answering as many of them as I can. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.